Hello, my name is Cheryl Jang. I'm an emergency room physician. I've been in there for about 30 years, maybe more, but we won't go into that. We're here to talk about COVID-19 today. What is COVID-19 or the coronavirus? Well, COVID-19 stands for the coronavirus 2019, the name that the CDC gave the virus that made a jump from animals into humans late in 2019. This virus is very similar to the SARS virus of 2003. And so SARS, MERS, and coronavirus 2019 or COVID 2019, they're all coronaviruses. So how dangerous is this virus now? Well, danger might depend upon two things: how many people actually get it, and then how bad it is actually once you get it. So the infectivity rate of COVID 2019 is measured in its R value. The R value is how many people in a room of 100 people would actually get the virus if you walked into it and spread your germs to them. So the R value for COVID 2019 or COVID-19 is actually 2 to 3, meaning that it will spread. This is an infectious disease. The R value, however, for many other things are much higher. So whooping cough or pertussis is 15 to 17, and tuberculosis is only at 10. That's pretty high. Influenza, though, is less than 2. So how bad is it if you actually get COVID-19? Well, most will actually do fine. For the most part, people will have a subclinical, light or moderate course, and they won't get that sick. There is a 2%, roughly between 1 and 3%, that actually will fare poorly and even die. So let's put this all into perspective. There have now been 20 to 60,000 cases of influenza in the U.S. this year, affecting 36 million people. That's a big number of people affected, and that's a lot of people who have actually died because so many people have become infected. But it's only a 0.1% mortality rate. COVID-19 carries a 10-fold increase in that infectivity rate. But at this time, Thursday, March 19th in the afternoon, only 176 deaths have actually been recorded in the U.S., and there's only been over 13,000 people infected. That's a 1.3% mortality rate. So this is a 10-fold difference from the flu, and it usually affects people with high comorbidities like hypertension, diabetes, and heart disease. That's usually in the elderly. What we need to do now is to limit the amount of people that this actually spreads amongst. Remember, 98% will actually do fine. The 2% will not do so well. So these are the absolute numbers for COVID-19, and they're actually better than we expected, and we want to keep it that way. And the only way we can do that is if we can contain the amount of spread. So thus, we want to talk about compassionate distancing. A caveat to how likely it is that you'll get it and how bad it's going to be is actually when you will get it. If 2% who are going to get it and get it badly actually get it all at the same time, then there's a huge rise in the curve of the number of people who get it. If we can actually flatten that curve and maybe spread it out over a longer period of time, then more resources will be available to these sick people instead of having it spike and run out of resources, run out of hospitals, run out of doctors. If we can flatten that curve and spread it over a longer period of time, patients actually do better. You'll get better service, better care, and actually our mortality rates greatly improve. But compassionate distancing is the key. It flattens the curve. So this is compassionate distancing as you minister to others by removing yourself on site from their presence, but you become present through other ways, through video chats, through prayers, through the willingness to even be involved in other people's social anxiety and fears and discouragement during this time. Many people ask about the kiddos. Well, in China, less than 2.5% of those under the age of 18 actually got infected. So their incidence of getting the disease is much less likely. And not only that, they actually get a less severe case. We just call them super spreaders. So there have been no pediatric deaths in the U.S. at this time. There has just been a tremendous amount of grace afforded to us, and so we are grateful for that. But this kind of leads to the question of so do I need to really get tested if I think I might have COVID-19, or should I just get tested anyway? Well, the reality is that testing actually doesn't change too many things. If you're sick, you just got to stay home. You have to self-quarantine for at least 14 days and remain home until you feel better and either are cough, fever-free, or you just feel, much better again. If you feel better before 14 days and you're mandated to return to work by getting a test, then go ahead and try and find a provider that will get you a test. But because there's so many cases cropping up, sometimes the test results get delayed between 2 and 10, even greater than that many days. So try your best. The best thing to do is just to self-quarantine if you feel sick. Now, if you do feel sick, should you go to the hospital? If you are truly short of breath, you have high fevers, you have a bad cough, you just feel really, really lousy, yes, go to the hospital. That's what we're here for, and we've been preparing for you for just weeks. So I just want to give a shout out to the medical personnel who are just on the front lines trying to deal with everything that's going on, putting themselves and their families at risk, and they are just really dedicated personnel. Thank you so much. But if you feel like you just have like mild symptoms, you're just not sure, you're feeling a little nervous, really, don't go to the hospital. Most people with mild and moderate symptoms will be sent home to self-quarantine, and you may or may not get a COVID-19 test with that. We're asking you to just go ahead and self-quarantine and contact your family physician. Now, is there a cure or a vaccine that you can go to the hospital and get for this? And the answer is no, not yet. It's too new. So rapid testing and vaccines are in the works, but they're just not ready yet. I don't have a fever, I don't have a cough, but I just don't feel good. I'm, kind of grounded from school and work. I feel anxious. What should I do? Well, it's really common for those who go to work or school for that to actually be one's place of socialization, integration, and ultimately identity. So if you're released from school or work and you feel a bit lost, well, take the time now to get really found, all right? Take the time now to find your identity in Jesus. So do daily FaceTimes and worship and just linger in it. You have the time now. And for sure, turn off the crazy pandemic social media that's going on right now. When there's a cure for COVID-19, we'll let you know, okay? Everyone's going to know. So you're not going to miss anything by turning off the social media. But the data is so crazy and so confusing right now. We don't know where the upward swings are because more people are getting it or because simply more people are being tested or we're getting better at measuring it. We just don't know. But the true rate, if there's more people getting it but not dying from it, that changes mortality, morbidity. You really don't care. You just want to know if you're going to survive this. And the answer is yes, you will do very well. So don't focus on the numbers right now. Instead, focus on what the reason for this season is really all about. The interruption of life's normal pattern usually means that it's just time to hit that reset button. So go back to the manufacturer's with a capital M default setting and put yourself into the hand of your maker. Don't align yourself with fear and panic. Choose trust and peace. And that's a decision. You have to choose trust and peace, even if the world makes you feel otherwise and you just don't have any peace in your heart right now. Believe and live out Psalm 91:3, for he will deliver you out of the snare of the fowler and from the deadly pestilence, which is the plague or COVID-19. Center yourself in him. And then encourage others to come around with you and center themselves in that same trust. Encourage one another through texts and chats, deliver groceries to other people's doorsteps, reach out to others who also are working from home or even worse, who don't even have a job right now. Loving others is definitely going to starve your anxiety. So rise above your circumstances. Find the reason for the season. Don't succumb to your circumstances. And get some altitude over the aptitude of thinking that you need to know everything there is to know about COVID right now, because there is not enough that you're ever going to be able to cram in your brain. And get altitude over the attitude of others who may be spreading fear and hoarding and abandonment and depression. God is here. God is here, and he's here in our community. So, just lastly, a few universal precautions that we have that everyone should know, but if we were really doing it, then we wouldn't be in this mess. Avoid close contact with people who are sick. Avoid touching your eyes, your nose, your mouth. Oh, excuse me. Stay home when you are actually sick. Cover your mouth with a tissue when you're about ready to sneeze and cough. Don't use your shirt sleeve. It can live there for 2.5 days. Cover your mouth with a tissue, then go ahead and throw it away in the trash. Go ahead and disinfect and cover your countertops and your household surfaces with cleaning sprays, and then wash your hands for 20 to 30 seconds. Did you hear that? 20 to 30 seconds. That's a really long time. So you want to wet your hands, put your soap on, rub it around, and then are you done? No, then you have to do that little things to each of the fingers, and you have really 10 fingers. This is really laborious. Get in the little web spaces, and then you have to do the little turn thing. And then voila, you look like a surgeon, all nice and clean, ready to have your altitude above the attitudes and above the aptitudes, and ready to have compassionate care for others. Blessings.